Hello, I'm Dr. P. Mahajer and I'm the Director of Spine Intervention here at Cellaxys. Today's topic is the aftermath of spinal fusion surgery, complications, potential side effects, and other treatment options. Spinal fusion is a surgical procedure in which two or more vertebrae are permanently joined. Vertebrae are the small interlocking bones of the spine. One question patients might have is why get a spinal fusion surgery? How is spinal fusion performed? Sometimes bone graft will be used and placed in between the affected vertebrae with or without special cages. Once the bone graft is in place, the surgeon may use hardware to implant plates, screws, and rods to keep the spine from moving. This is called an instrument fusion. Spinal fusion is performed to treat or relieve symptoms of many spinal problems. The procedure removes mobility between the two treated vertebrae. This may decrease flexibility, but is useful for treating spinal disorders that make movement painful. Some of these disorders include, but are not limited to, tumors, spinal stenosis, herniated discs, degenerative disc disease, fractured vertebrae that may be making the spinal column unstable, scoliosis, which is curvature of the spine, kyphosis, which is an abnormal rounding of the upper spine, spinal weakness or instability due to severe arthritis, tumors, or infections. Spondylolisthesis, a condition in which one vertebrae slips onto the vertebrae below and causing severe pain. A spinal fusion procedure may also include a discectomy. When performed, a discectomy involves removing a disc due to damage or disease. When the disc is removed, bone graft are placed into the empty disc space to maintain the right height between the bones with cages. A surgeon uses two vertebrae on either side of the removed disc to form a bridge or fusion across the bone graft to promote long-term stability. One might ask, how is the recovery after spinal fusion? After a spinal fusion, patients need to stay in the hospital for a period of recovery and observation. This generally lasts anywhere from 3 to 4 days. After surgery, patients are instructed about new ways to move, since flexibility may be limited. This includes new techniques to walk, sit, and stand safely. After the patients leave the hospital, they usually need to wear a brace to keep the spine in proper alignment. Patients may not be able to resume normal activities until the body has fused the bone into place. Fusion may take up to 6 weeks or longer. Full recovery for spinal fusion will take 3 to 6 months. The patient's age, overall health, and physical condition can all affect how quickly they heal and are able to return to their usual activities. Patients are recommended to consult their doctor if they exhibit any signs of infection such as redness, tenderness or swelling, wound drainage, shaking chills, fever higher than 100.4 Fahrenheit. Now let's move on to complications. Complications following spinal fusion. Spinal fusion, just like any other surgery, carries the risk of certain complications such as infection, blood clots, bleeding, blood loss, respiratory problems, inadequate wound healing, reactions to medications or anesthesia itself. Spinal fusion also carries the risk of the following rare complications: damage to a spinal nerve, which can cause weakness, pain, or bowel or bladder problems, additional stress on the bones adjacent to the fused vertebrae, persistent pain at the bone graft site, heart attack or stroke, blood clots in the legs that can be life-threatening if they travel to the lungs. Physical activity too soon after surgery can result in what's called pseudoarthrosis, which is a bone fracture or a non-union of the bones. This may require second surgery. Smoking, diabetes, and advanced age can also increase the risk of developing pseudoarthrosis. The most serious complications are blood clots and infection, which are most likely to occur during the first few weeks after surgery. In certain conditions, the implant of plates, screws, and rods will need to be removed if it's causing pain or discomfort. What are some of the alternative treatment options to spinal fusion? Mesenchymal stem cell therapies are an exciting treatment alternative to spinal fusion and lumbar disc replacement. In some cases, a patient's own mesenchymal stem cells may be able to replace the need for surgery. This treatment can lead to dramatic improvement in the low back pain while significantly decreasing the risk and recovery time associated with traditional invasive back surgeries. Injections of mesenchymal stem cells into the damaged disc may decrease painful inflammation, repair damaged disc cartilage, and improve hydration and disc height. Mesenchymal stem cell therapy can dramatically reduce the number of days lost to disability and return patients to work and recreation much quicker when compared to spinal fusion surgery. In summary, spinal fusion surgery changes how the spine works by immobilizing one portion of it. The areas above and below the fusion are at increased risk for wear and tear. They may become painful if they deteriorate, and it can lead to additional problems. Mesenchymal stem cells and other regenerative medicine procedures work not to immobilize, but rather repair and regenerate the injured discs. Schedule an appointment to see what options are available for you. Thank you for watching. I hope this was informative. Thank you.